Hope everyone is doing well. Patients, new patients, or any type of patient that is seeking care for ingrown toenails, there's an element of uncertainty that patients, I'm sure, think about before they go see the doctor. You know, what's going to happen? What are they going to do? What does the procedure consist of? I'm sure what a lot of patients, I think about is, and they dread, is the injection, right? Oh my God, they have to numb my toe. So what I'd like to focus on today is, you know, how do we numb the toe? So people really understand what it entails to numb the toe. And I think that this video may provide to some viewers or people from all around the world some peace of mind, right? The unexpected is very uncomfortable for a lot of people. So I think this is going to be not for the patient so much, but let's go to the whitey board. I'll try my best here. So we're going to look at it sort of, you know, from the front. Let's just make believe this is the front of the toe, right? That's the toe. Obviously, sort of not to scale, but let's just say this is the nail, right? We'll kind of go like this, right? So back here, people think that we numb right next to where the problem is. Let's say in this case, we have an ingrown nail here, so we only numb this area. No, it doesn't work like that. So we have several nerves, right? Come over here. Back here. Again, just to show everyone, we don't just numb here. We numb the back. Okay, we have one nerve here, and one underneath. So what we do is called an H block. And the H stands for hallux. That's the great toe. So what we want to do is, you know, you have nerves here, here, and one crossing underneath, and one here, and one on the top. So what we basically want to do, if you guys can imagine, is, that's why it's called an H block, because we numb the top nerve, the bottom, the top here, and also the top on the other side. I hope I haven't confused anyone. But the bottom line is that you have several nerves that innervate, that attach and provide that sensation, these sensory nerves, to the affected area. Let's get down to business. So today we are performing bilateral total nail avulsions, total nail removal of the entire nail plates. This patient has been battling fungus. He's a young gentleman battling fungus for 10 to 12 years, I believe. 10 to 12 years. He has tried some things here and there, a lot of trauma. We spoke in great length yesterday about his clinical presentation, but without further ado, we're gonna remove the toenails and start fresh. This approach I'm not super duper fond of, but it's really effective, especially in the younger crowd. So we're gonna remove the nail plates. We're gonna implement a really aggressive antifungal protocol regimen consisting of oral terbinafine. We're gonna pulse dose that, the oral Lamisil, which is a great medication, extremely effective. Once the new nail starts to grow out, we may consider maybe a laser treatment or the pathformer treatment as well. And also, more importantly than anything, the topical antifungal protocol. So we have all that, the whole, what I like to call the whole enchilada. But again, let's focus first on, you know, what we're gonna be doing. I tell patients, I'm very, very transparent. The patient will feel some burning. The burning is, okay, come around here a little bit. Okay, do we have a close up on there? Mm-hmm. More close up. Just kind of like that. Okay. So I like to tell patients, and in you know, in my experience, I like to talk to the patient because I let them know what are they to expect in the next second or two. So then they'll know, right? People like to be informed. So cold spray, the cold spray, so that they don't actually feel the little stick. And now you're gonna feel burning on the top. A lot of burning on the top. Burning on the bottom. Burning on the bottom. Burning on the bottom. A lot of burning on the bottom. A lot of burning on the bottom. Burning on the top. Remember, guys, it's an H block. Don't forget the H. Now on the top. This is the H. A lot of burning on the top. In the inside of the toe now. A lot of burning on the inside. A lot of burning. A lot of burning. You guys can see it right here. We're here. A lot of burning. Burning, 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 burning. And then we're out. Okay. Now we're going to do another cold spray. Here we go. Ready? 1, 2, 3. Little cold spray. Okay. A lot of burning on the bottom. A lot of burning. Here we go. Ready? Here we go. You're doing great, bud. Okay. A lot of burning. And then that's it. So now, the last one that we need is this one, okay? One more. Here we go. Little pinch. And a lot of burning on the bottom. A lot of burning, a lot of burning, a lot of burning. And then we'll go ahead and we're done here, okay? So, so now what we're going to go ahead and do is we're going to go ahead and do the other one. We'll definitely put a stop here, okay? And then I will attach in a different video. I'll definitely do the we'll present the case, okay? We'll show the actual bilateral total nail occlusions. But the most important thing about this video is how exactly do we numb the toe? Okay, and that's exactly how. It's an H block. How do we numb the toe? That was the purpose of today's video. I hope this is informative. I hope everyone enjoyed the video. I'm sure the patient did not enjoy it at all. I know because I'm looking at him. But at the end of the tunnel, there is light, which is the outcome. And he's going to be very happy. So like always, www.jawspodiatry.com, Instagram, Dr. Toe Jam, Jaws Podiatry, Facebook, and last but not least, our